Great question. So when I'm evaluating a patient for a tummy tuck that has an elevated BMI, there's really two things that I as a surgeon am trying to figure out. So the first thing is, can I get a good result on this patient? And the second thing is this a safe surgery? So first let's talk aesthetics. So I look at the patient and figure out how their weight is distributed. Do they have a lot of weight around their neck? Do they have a lot of weight in their midsection? Do they have a lot of weight in the lower body? A lot of weight around the neck can indicate a difficult airway, so it's something to always consider. A lot of weight around the midsection can indicate visceral fat, which makes tummy tucks less likely to get a good result, and sometimes you can't even get enough laxity to perform one. So those are important considerations. You have to look at the patient and not the number. How the weight is distributed is very important. The next thing is it's important to consider that BMI is not a great indicator of overall health, but it has been found to be an independent risk factor for certain surgical complications, meaning just that number being elevated, not taking into account anything else, leads to a higher complication rate. So is that complication rate worth taking on as a patient? It can be in a lot of people as long as there's not other things going on. So we need to look at your overall health. So I look into my patient's medical history, I see what kinds of medications they're on, and we try to figure out whether the risk to the procedure makes sense. And in many patients with a BMI of 33, it does.